It's exactly 3.5 or slightly more than 3.5 years ago when the world was hit by the global COVID-19 pandemic, and that put the whole world into some kind of shock. And to many of us in this part of Africa, we resorted to a lot of natural herbal stuff as one of the remedies. And to many of us who took that, we survived by God's grace. And to some other people, perhaps they got reactions of, they got challenges, diseases, and all that coming out of that stuff. And that arises from a couple of challenges that we are yet to explore in this conversation, which is looking at the toxicity within herbal stuff, herbal everything. And to help us condense and perhaps break down this conversation, we are privileged and honored to be with Dr. Jen, Senior Lecturer, College of Natural Sciences, Makerere University. Dr. Jen, you are most welcome to Health and Wellness Program.
Thank you so much.
Yes, when we talk about toxicity in plants, in herbal medicine, what exactly are we talking about from where you sit as a scientist?
Yeah, thank you so much, Arthur. Herbal medicine has been presumed to be safe, and indeed most of it is safe. However, it is toxic. Some of it can be toxic. And the toxicity can actually come from the plant itself. There is what we call inherent toxicity, where a plant produces chemicals to defend itself. But in the long run, it can be used by humans actually to treat so many diseases, but also those chemicals can be harmful to the humans. And then we also have another type of toxicity whereby herbal medicine can be contaminated by so many other chemicals like pesticides. They can be contaminated by microorganisms that actually cause diseases. They can be also contaminated by metals, heavy metals. All these have adverse effects on the health of human beings. And so when we look at toxicity in herbal medicine, are those effects, the adverse effects that a human being can get after taking herbal medicine.
You have spent quite some time on this as one of your areas of research. Should we get worried? We seem to have quite a lot of, and indeed during the pandemic we saw quite several people using herbal stuff, herbal medicines, herbal concoctions and stuff like that. Should we get worried considering what we have on the market now?
I can say that for some herbal medicine, you'll find that these medicines have actually gone through protocols from collection up to manufacture. So some of it is very safe. But there is that other medicine that you'll find on the roads, that you'll find in the markets, stored in very, very bad conditions, where you will see that this medicine will actually get contaminated with microbes or with aflatoxins. So to some extent, we can get worried if we are picking this herbal medicine in a wrong place. Otherwise, if we are picking it in a right place, like there are so many registered herbal medicine that are found in pharmacies, those have gone through all the protocols and NDA has actually certified them. And so if you get such herbal medicine from a pharmacy which is already registered, then you shouldn't get worried about it, because we know that herbal medicine actually has therapeutic values and it has been used for centuries to cure so many diseases.
There are some herbal medicines that our grandmothers and grandfathers gave us
Yes.
during our childhood, and perhaps you don't find these things on the pharmacies and all that, in the pharmacies. Should we get worried about that also? Because I mean, right now we are seeing the occurrence of a couple of diseases and all that kind of stuff. The cancers that are mushrooming, we don't know the causes yet. But should we worry that perhaps it's that herb that was given to me by my grandmother so many years ago that perhaps could cause this? Why should we really get worried about that?
Yes, you see, herbal medicine can have what we call acute toxicity, whereby you will take it and get effects there and then, like for example, shivering, sweating, vomiting. So that one you can actually be able to tell that this is toxic, okay? But we can have that herbal medicine where you'll take it, you'll not have those acute symptoms, but in the long run, you'll actually be affecting either your kidney or your liver, or you'll be getting ulcers. I'll give an example of ginger. We all know ginger, you know, very effective antibacterial. And it was used during COVID-19 pandemic. But you see, ginger can actually cause ulcerations in the stomach if it is either used too much of it, or it is being used with someone already who already has some ulcerations. So you can't know whether this medicine actually has some adverse effect that can be detected after a long time. So in that case, we need to be worried.
Okay.
Yes.
How should we take care of, you know, the harvest, the post-harvest handling and all that kind of stuff?
Yes, it is actually very, very important that for a herbalist, actually there are so many herbalists who have been trained on how to handle this herbal medicine. Right away from the garden, you have to handle this medicine in the right way. For example, you are at the garden. Are there any pesticide use around the garden? Then you just know that some of this medicine may be contaminated. So you have to be aware of that. Also, when you are collecting, what are you using to collect? Some of the people just use tools that are actually dirty, contaminating the herbal medicine with bacteria. So you have to make sure that whatever tool you're using, even during harvesting, is very clean. Transportation, how are you transporting it? Storage, how are you storing your herbal medicine? Is it in a clean, dry place where it will not be contaminated with any of the chemicals or any of the microbes? So it's very, very important to follow protocols from the harvesting period up to manufacturing period.
You are talking about protocols, and yes. I hear you loud and clear, but that is you and me,
yes,
who are standing on this table right now, especially where you do most of this stuff from. But here we are talking about somebody who has not had the privilege of sitting where you are, or perhaps having the training that you have as a chemist, which you are. How does somebody then get to know these protocols and all this stuff? Do we have them?
Yes, we have those. Actually, worldwide, the World Health Organization has set up protocols on how, from harvesting to manufacturing, the guidelines on how to handle herbal medicine. Even National Drug Authority, it also has these guidelines. But we have also had trainings. The Ministry of Health has always advertised for herbalists to come and train on how to handle these herbal medicine. And of recent, I visited in Wandegea. I visited that part of Ministry of Health that deals with herbal medicine under Dr. Nambatia. I visited her place, and there are so many herbalists that were trained on how to handle herbal medicine such that it doesn't get contaminated with either chemicals or microbes.
What are the signs and symptoms of that toxicity we are talking about? Yes. How do I tell that I've taken a toxic herb or a toxic medicine, herbal medicine?
Yeah, thank you so much, Arthur. Just like as I said, we have acute toxicity, just like any other medicine or any other toxic chemical. When you take it, immediately you vomit or feel like vomiting, or you're shivering, or you're sweating. All these, you have diarrhea, immediately you have taken this herbal medicine. That shows that actually there is toxicity in this medicine that you have taken. So it is very, very important that once you see this, you either look for medical attention, because it means that you have taken a very toxic medicine.
You are saying we look for medical attention,
Yes.
and that is a very sensitive issue. Remember, if I'm not feeling well, I'm supposed to go and see a medical personnel somewhere.
Yes.
But here is the case where, as it were during the COVID pandemic, lockdown, total lockdown, no movements, no nothing. And I'm not feeling well, and I have been told 1 or 2, 3 or 4 herbs can actually solve my problem. And here I run, I pick and all that. And then you're telling me after, then I run to the medication to see a practitioner. Now, I have not consulted a practitioner in the first place.
Yes.
Now you're telling me to run after. Where is the reconciliation between that self-medication from the herb perspective and you from where you sit as a researcher? What is your take on that?
Yeah, actually, of course, we have some herbal medicine which have been used for a long period of time, okay? And there is no report at all of toxicity, that acute toxicity. So it will, if you really get these adverse effects, then it could have been maybe your body has rejected this. But in case you actually take this herbal medicine and you get such adverse effects, it would be recommended that you actually see a medical practitioner. That's why we actually need to work together. Herbalists need actually to work together with the medical practitioners when patients are using this herbal medicine.
Do you see that happening, especially in this country of ours?
Yes, actually these days I've seen so many medical practitioners that are working in line with the herbalists, because sometimes you find that this herbal medicine can actually they can reduce the side effects of other medicines, the conventional medicines. So once a herbalist has consulted, with a medical practitioner, says, you see, this herbal medicine can actually reduce side effects. Like, for example, cancer therapy. Cancer therapy has so many side effects, and which can actually be relieved by herbal medicine. So in that case, if there is that relationship between the herbalist and then the medical practitioner, why not? These two can actually work together.
Dr. Jane, senior lecturer, Makerere University College of Natural Sciences, and she has done extensive research in the field of herbal medicines and all that. And we are here with her. We are trying to explore, looking at a couple of options that we have, again, basing on the research, extensive research she has conducted over the years. We are trying to pick her thoughts, pick her experience that perhaps can inform lots of the practice that we have out there. Dr. Jane, in the medical field, you are a scientist. There's no need, you are not allowed to advertise yourself and, to go around, I'm the best here.
Yes.
But we have all kinds of adverts going on from the field of herbal. Do you see any problem with that?
Yes, actually I see a problem with that, because this is where then the quack doctors come in. And I think the problem is the stringent. We don't have stringent regulations, because if we had those stringent regulations, we wouldn't even allow these adverts, to appear on TV stations and radio stations. But this is happening. And especially in Africa, these regulations are not so stringent. you know, but in other places like in China, you find that these regulations are followed to point that you don't just advertise your medicine. So I think we need to come up with the stringent rules and regulations such that no doctor just comes up and then says this and this works, and yet we don't know whether it actually works, because we have seen, we have done some research with one of my students, and we looked at the aphrodisiac, the ones that actually increase sexual, that increase. Yes.
That seems to be the most, I was actually coming to that, but yeah, just mention it, continue.
Yes.
Yeah.
We actually realized that most of the herbal medicine that is being sold out there has been contaminated or adulterated with the synthetic ones. So just imagine, this is a herbal medicine, and then we have Viagra added to it. And then a patient takes. The herbal medicine, yes, works, okay? It increases, maybe it increases the flow of blood. And then we are having Viagra, which also is increasing the flow of blood. And so what will happen if someone has high blood pressure? You'll find this person actually, you know, breaking down. So this is what I'm saying, is that these adverts are actually not good, you know. And I think this is where the Ministry of Health should come in, so that people are not conned. You know, someone comes and says, I have this herbal medicine, it treats 20 diseases. You know?
Here we are torn apart between entrepreneurship, because then you have to be seen to be doing something.
Yes.
To earn a living.
To earn, yes. True.
And as you're doing that something, of course, then perhaps you're paying taxes and things like that, and we seem to have a lot of these products on the market.
Yes, there are many.
That are said to be increasing the blood flow, to help somebody in very many aspects. As scientists, you're the scientists we have, and perhaps those that we depend on when it comes to such kind of advisory. Being stuck between entrepreneurship, being able to put some money in the pocket,
yes,
and compromising someone's health. In between is a scientist, a chemist like Dr. Jen. What do you have to say about that?
Yeah, I think it all has to do with training. You know, I think we need to train these herbalists. You see, when it comes to conventional medicine or the medical practitioners, these people go through a series of steps until they become medical practitioners. You know, they value the health of their clients, and here is a person who is saying, I need money. Okay. So I think if we train these herbalists, you know, we emphasize that, you know, these people you're dealing with are your clients, yes, but you have to ensure that their health is not compromised by what you're giving them. So I believe through training.
Do you think they would allow?
Yes.
Do you think you would succeed on that? Because you mentioned earlier on that we don't seem to have a clear regulation around that.
Yes, I think this is just a change of mind. Yes, because I believe that if you train someone, you tell him the repercussions. What will happen if someone has taken this herbal medicine, you know? I think at the end of the day, they will actually change and be able to follow. So that if I'm producing a herbal medicine, let me not, you know, adulterate it or put another synthetic medicine to it, because it is going to affect your client.
Okay. Do we have a mechanism where we routinely check, perhaps on the streets, to see what is there and to what extent it has been contaminated, perhaps with toxic substances and
Yes,
stuff
actually,
like that?
actually, National Drug Authority is mandated to do that. And the student I'm actually talking about, I talked about just a few minutes ago, we did that work in connection with National Drug Authority. And we actually found out that some of the medicines are contaminated. So NDA is mandated to do that routine check, just like you see UNBS, you know, going around to pick products and then testing it. NDA is also mandated to do that.
Africa is endowed with so much diversity in terms of, you know, the plant species and all that.
Yes.
I think perhaps the cradle of medicine
Yes.
in the rest of the world, because
Yes.
you know very
Yes.
well, most of the medicines we have on the market, the antimalarials and all these stuff, they actually come from these herbs and stuff like
True.
that.
True.
Is there a relationship you're having with the National Drug Authority and many other perhaps regulatory bodies
Yes.
around this to make sure that we do the right thing? Because the fact that you're a scientist and you are the authority behind this, do you have any working relationship that we can leverage on and say, okay, this product has come through a consultative process across, and then we are able to trust it or to believe it?
Yes, we actually have so many herbal medicine that is registered. First of all, because I'm trying to respond to your last comment. We have so many herbal medicine that has been registered by NDA. And the only thing actually that NDA requires of a herbalist, has there been long-term use of this herbal medicine? Is there any reported toxicity or not? If there is no reported toxicity, then just look at the phytomedicines or the phyto compounds that are there. Then after that, once NDA has that report, then it will register your herbal medicine. And for me as a researcher, just as I said, I've been working with the NDA, some staff at NDA. We do the research, but they are supposed to put it out there, you know, because they are the ones that are mandated to do that. So when we did that research on aphrodisiac, we finished, we had our report. And actually, I just don't remember, it appeared in the New Vision that some of these medicines contain other synthetic aphrodisiacs, so they shouldn't be taken. So we have a working relationship. Even right now, I'm working on aflatoxins in herbal medicine, and one of the investigators is also from NDA. He's called Mr. Wilberforce Kwiringira. He's from NDA. So once we have our results, then NDA can actually publish these results to inform the public.
You mentioned aflatoxins. We are told more often it's in food, it's in all this. But you're mentioning it also in herbal medicines.
Yes.
What brings these aflatoxins? What are aflatoxins in the first place? For a layman to understand.
Aflatoxins, you see, when we have fungi that causes aflatoxins, when you have any material, like for example maize, you know, leave it in a wet place, it will develop fungi. I think you have seen maize with green coloration, you know, around it. So when it develops fungi, then the fungi will actually produce those aflatoxins. And of course, if you're going to take it now like the maize, at the end of the day, you'll find this chemical contaminating any material. As long as you leave it there in a wet environment, fungi develops on it, that specific fungi that actually produces the aflatoxins. So even herbal medicine, if you have herbal medicine harvesting it, you have to keep it in a dry place. Otherwise, if you keep it in a wet place, then fungi is going to get contaminated, contaminate it, and then it will produce their aflatoxins, and at the end of the day, you'll actually take contaminated herbal medicine.
Again, Dr. Jen, a chemist in the Department of Chemistry, senior lecturer, College of Natural Sciences, Makerere University, an expert in the field of herbal research, and we are trying to explore quite a couple of thoughts, ideas that she has picked along the way, which could be useful for every one of us out there. Doctor, you seem to mention to take this direction towards the way we handle what we collect. Yeah, perhaps it's traditional knowledge that this herb used to do this and that, and we know, you know,
Yes.
but at the end of the day, the herb we are talking about is harvested in a wrong way. It is stored in a wrong way.
Yes.
It is transported in a wrong way. And perhaps it is processed in a wrong way. It cuts that across that value chain. Have you people tried to look into the value chain of harvesting this stuff so that we are able to come up with clear protocols or guidelines on how this journey could begin right from the start to perhaps the end where it ends, so that then everyone who is involved at the different stages in that process then has a very good picture or clear picture on how they should handle these things. Do we have such kind of a mechanism in place?
Yes. Actually, you see, when we researchers do research, it doesn't just end in the lab, okay? We have to find ways of how to mitigate these contaminations. And with the REEF project, a research and innovation project that we are working on, aflatoxins, pesticides, at the end of the day, we have a protocol, okay, or standard operating procedures of how to harvest these herbal medicines in a right way, on how to process it in a right way, on how to handle it, even just drying it. So we have these protocols in place. And so what we do is that we go out and then train these people who are involved. And of recent, we met so many herbalists that are actually manufacturing most of these herbal medicines that you hear. And we met them, we trained them on how to handle herbal medicine so that it is not contaminated with these chemicals or bacteria. So we are doing this. We don't only end in the lab, but we also go ahead and meet these people and then train them. And I'm a chemist, but I've been going out there. I've been meeting herbalists, even traditional healers, you know. And during that time of meeting them, we always have a one-to-one talk. I always ask them, how are you doing this? How do you dry your materials? And then they'll tell you, yeah, I'll put it there under the sun. Then you advise them, no. You see, if you put your sample under the sun, you'll actually lose the bioactive molecules. So what you can do, dry under shade. And if you're drying, make sure that the place is clean so that, you know, your medicine is safe. So we always have this interaction wherever we meet these herbalists or traditional healers.
Okay.
Yes.
How do I distinguish one that has gone through that advisory process and one that has not gone through that?
Of course, it's very, very hard to distinguish between these two people. But the only way that I would advise, you know, clients or the community or the local population, if you're going to use a herbal medicine, any herbal medicine, first of all, there are so many in the pharmacies.
Yes.
You know, the famous Covidex. You know, we have for cough, Kabuti. All those have been registered. So if I have a cough, And I know that I'm not advertising this, you know, but these are registered and you'll find them in the pharmacies. No? So if you have those registered and they're in the pharmacies, you know, these have gone through the protocol. They are safe. But otherwise, if you go to a place, you want to buy herbal medicine, first of all, look at the environment where you're buying this from. Is the medicine you're going to buy, I mean, is it stored well, you know? So you have to gauge and see where you're buying this from.
Of course.
In that case, you actually know whether what you're buying is contaminated or not.
Of course, in most cases, this is determined by what you can afford. Many people may not afford to walk to that pharmacy to look for this or that.
Yes.
And they may end up through self-medication, but through the other route and things like that.
Nice.
Because these days,
yes,
science is the way to go. And we seem to be pointing our guns towards the scientific industry, and sector and stuff like that. Where do you start and where do you stop in this process of advising us out there about whether we should not or we should take? Where do you start and where do you stop as a scientist?
Now, as a scientist, I have a herbal medicine, okay? First of all, I have the first thing that I'll have to look at. Does this herbal medicine work? And we are talking about the efficacy. Does it really work? Good, it works.
How do you know it works?
Yeah, we have so many processes that we do. We look for the activity. For example, I'll give you an example of mululuza. You want to know whether mululuza works, okay? Yes, people have been taking it, but we need scientific evidence. Does it actually work? So you have your mululuza. So what we do in the lab here, we extract out using different, we can use water, we can use any other organic solvent. We extract out those components in the plant and then we test them on the parasites to see whether the parasites will die or not. So in that case, we even know how much of it do you need actually to kill this parasite. So in that case, we'll know whether the plant is efficacious or not, whether it works or not. So that is one thing. If we have proved that this plant actually works, then is it safe? You know, we talked about toxicity, acute, and then subacute, where you have someone taking it continuously. It is not killing you, but you are taking it continuously. So do we have any effect of this medicine after long-term use? So we look at safety of this plant. Now, once we have actually shown that this plant is efficacious, it is safe, we have to look at the chemicals. Now, that is where I come in most. The chemicals that are in this plant that actually make it work. And once we know those chemicals, we can actually advise. Because you see, if someone is producing a herbal medicine, there must be an active ingredient in it. Okay? But what is that active ingredient? Once you know it, you can even be able to follow your medicine 1 month. Is it active? Is it working? Will it be able to work even after 12 months? So if that active ingredient is still there after 12 months, then you can actually say, okay, I think this herbal medicine can last even for 2 years, or it can last for 1 year. So that's where I come in as a chemist, and if I find these chemicals are actually called markers, chemical markers. So it's the one that you use to know whether this herbal medicine is still working.
Do we have been told, again, we see a little bit of increase in cancer patients. Cancers which used to be diseases of
Yes.
old rich people. Now we are seeing babies and children and young fellows dying or getting cancers and things like that. How much of that do we attribute to consumption of toxic herbs in that perspective, from where you sit as a senior researcher?
Yeah, that is really very difficult to say because I can't know the contribution of herbal medicine in causing cancer. You can't know, but the fact is, with contamination of pesticides, pesticides can actually, there are some pesticides that have been found to cause cancer. So with contamination of herbal medicine with such pesticides, we can actually say that there is a contribution. There is also contamination with heavy metals that have also been found to be toxic or causing cancer. So we also have that contribution through contamination with heavy metals. But to give you a percentage that I'll be lying to you, but for sure there must be a contribution because research has actually shown that herbal medicine is contaminated with chemicals that can actually cause cancer. So we have to do this frequently to ensure that we actually look at these herbal medicines that we are manufacturing, to ensure that they are free of these contaminations. Yes.
On health and wellness, we explore what perhaps is possibly killing us that we may not know, but also how perhaps we can handle some of these challenges as they come, but relying on expertise from those that have been on it scientifically, from those that have done wide research and investigations in some of these aspects. And that's why we are engaging with Dr. Jane, and the story begins here. The story is yet to be unfold and bring quite more interesting conversations around this area. But as we try to wind up,
Yes.
Doctor, because we are going to definitely have quite a number of conversations around this area.
Yes.
We are now on contamination, and our emphasis here is on contamination. Our emphasis is, do we know that we have poisons in some of these things we take on a daily basis? And you have said yes, some have and some may not have.
Yes.
What should we avoid and what should we go for wholesale, in perhaps briefly from your experience?
I think my advice as a scientist, I would advise the population to go for the registered herbal medicine. But we also have those that have been used for ages without any effects, you see. But the only thing is to know how to handle them, okay? If you get your medicine from the bush, mululuza, boil it, drink it, that wouldn't be a problem. But also, you may be drinking a lot, more than you need.
Yeah, everything in moderation.
Yes, everything in moderation. So, but I would advise the population to go for what is registered, first of all, in the pharmacies and most of the drug shops. But of course, there are these herbalists that are really known, and you see, these herbalists have been, they are not registered. Of course, these days, actually, they have started registering herbalists. But you find those who have been doing this work for 10 years, for more than 10 years, They have the experience. Actually, there are those who will even tell us that this medicine is toxic. The person has not even tested it, in the lab. But the herbalist will tell you, this one is toxic. And if I'm to use it, I'll use this other one, in order to reduce down the toxicity. So there are those who are actually known. And actually, when you look at the way they handle this herbal medicine, you will see that they are handling it in the proper way.
Okay.
Okay. So make sure you go to those herbalists that are known, you know. Don't just move to any herbalist and say, I want this, I'm sick of this, when you don't know how these herbalists are handling the herbal medicine that they are going to give it to you.
Dr. Jen, it would be very unfair to leave this place without telling people who are following us what is actually happening in the background. Are we doing that? Are we looking at that? Are we manufacturing one herbal drug here or something like that?
Yeah, I told you earlier on that when we want to test a medicinal plant, we extract out. So what we have here is one of the solvents that we use for extraction of a herbal medicine or a medicinal plant. But in this machine is called a distillation machine. What we do is that we want to ensure that the methanol we are using is pure. So we distill off. And then at the end of the day, we have pure methanol that we can now use to extract the medicine. Yes.
All right. Now that would be taking us to a different level altogether.
Yes.
But we will end it here for now. We'll get to that process a little later.
Yes.
Because I think our interest here is walking our people, our followers through a journey, a process. And of course, being a lecturer here, there are so many students that are going through your hands.
Yes.
And perhaps these are potential entrepreneurs who are actually going out there, perhaps to translate this knowledge into what exactly we are talking about.
True, true.
And perhaps we'll feed better from that expertise at a later point. So, but for now, thank you very much for your time.
Welcome. You're
and
welcome.
This is just the beginning. We definitely are going to continue this conversation and explore a couple of other things.
Yes.
Health and wellness, we end it here for now. But of course, with a lot of conversations that are coming along the way. But for now, we'll end it here. But keep following us. There is quite a lot that we'll have engaging professionals like Dr. Jen.
Yeah.
And have yourself a very good day.